Yes, we can see your power slides.
Okay, good. If I only can just, I'll get rid of here. Yes. Okay, so my talk today is coronary balloon tip damage, a bench and clinical study. Can you hear me okay?
Yes, yes, we can hear you okay.
Good. And I'd like to acknowledge co-workers, Bruce Weber from Auckland and Trine Barkholt from Denmark. We observed damage to tips of balloons used for crossing through the sides of stents for side branch access. The aims of our study were to confirm that balloon catheter tip occurs clinically and to bench test different balloon designs to compare susceptibility to tip damage and understand a bit more about tip damage. And we also wanted to discuss causes of failed balloon access to the side branch. We prospectively collected balloons that had been used to cross or attempted to cross to the side branch through the side of a stent. And we examined those balloon tips with a microscope. Here we see a picture of a balloon attempting to cross through the side of a stent. So the balloon tip may catch on the stent strut and be deformed and obstruct passage to the side branch. The arrow points to the damaged coronary balloon catheter tip. And here is a stent that is much more damaged, a balloon that is much more damaged as it attempts to cross through the side of a stent. In addition, when a tip is damaged, catheters may catch on a stent and cause distortion. So you'll see that this stent here is badly distorted due to this tip catching on a strut. I'll just see if I can, good. We also, on the bench, noticed that catheter tip distortion caused stent distortion in different designs of stent. These are micro CTs of 4 different kinds of stent. And we also found that this distortion of stents caused by balloon tip distortion could be corrected by kissing balloon post-dilatation. The damaged tip may not be readily visible visually, so that's why we examined the balloon tips with a microscope. Of 95 balloons used clinically for attempted side branch access, 66%, well over half, showed some degree of tip damage. And so of 95 tips, 63 or 66% had some tip damage. And in addition, of the balloons that failed to cross, 85% had tip damage. We aimed to compare different balloon designs for susceptibility to damage. This is the apparatus we used. Here's a balloon, and it is passing over a 0.014 wire. We had a hole in a plate that was just enough to accept the wire, but not the balloon tip. And then we attached this to an instron. An instron is a common engineering tool that you can use to apply a force to a stent and then measure how far it moves, or conversely, you can apply, you can program it to move a certain distance and measure how much force was used to move the stent that distance. So here we have the instron, the balloon, wire through the hole in the plate, and here we have the instron shortening this stent, this balloon, by 0.5 millimeters, and you'll see diagrammatically that the tip has been damaged. Here's a higher power picture. So the instron was used to shorten the balloon by 0.5 millimeters and measure the force required to do that. balloon catheter tip compression by 5 millimeters caused damage. So you can see here the balloon is being compressed by 5 millimeters, and this is a video going over and over again, the same picture. And here is a picture of the balloon catheter tip before, and here it is after compression with the instrom. And here we have another design, and in this design, there was only minimal damage after compression, 5 millimeters, 0.5 millimeters. Now we looked at the maximum force for 0.5 millimeters compression in a whole bunch of different designs, from the metanol, which has a spring metal reinforcing in the tip, down to the Terumo catheters. And many were required relatively low force, but the Trex and the metanol required a lot more force to be shortened. And here are pictures of the catheter tips before compression, and here we have them after compression. And you'll see the metanol with this wire coil reinforcing was not damaged. And also the Trek, non-compliant Trek, was only minimally damaged by compression, whereas the others all had significant damage to the tips. And here's a scanning electron microscope of the metanol tip, and this is the wire coil that reinforces the tip. We also measured balloon tip diameters. What we found was for different balloon sizes, 1.5 millimeter balloon, 2.5 millimeter balloon, 3.5 millimeter balloons, there was no difference really in the diameter of the tips. This means that choosing a lower profile balloon to cross through the side of a stent doesn't really make much sense, because the balloon tips of all sizes of a particular manufacturer are basically the same. That's the balloon tip, not the area where the balloon material is attached. So tip diameters of 3.5, 2.5, and 1.5 millimeter balloons of the same design have the same tip diameter. And if a balloon will not cross, changing to a smaller diameter balloon of the same design may not make sense. However, changing the balloon does make sense, because it is likely that the balloon tip was damaged if it won't cross. Sometimes, if you try and cross a tight coronary stenosis, it's not the balloon tip that obstructs passage, but the area of the balloon where the balloon material is attached. So this is the tip of a balloon here, which is made by extruding plastic. Here is the zone of balloon attachment to this, and here is the balloon. And we measured diameters here and here, and what we found was there is more balloon material with increasing nominal balloon sizes, and non-compliant balloon material is thicker than compliant, semi-compliant. So that's shown here. Here we have this checkered appearance here is with a 1.2 or 1.5 millimeter balloon, and here this is a 3.5, and you'll see that the diameter at the balloon attachment is greater with non-compliant balloons and bigger balloons. Possible causes of a balloon failing to cross to the side of through the side of a stent include balloon tip damage, which we have discussed, and if a balloon won't cross, one thing to do is to change the balloon, because the tip may be damaged and be obstructing passage. Also, another cause is extraluminal wire, the complexity of the cell shape, and the angle of approach. So here is this is a bench test of a model on the bench, and you'll see here is the stent, here is the side branch, and this wire has passed outside the stent and then enters the stent and then goes through to the side branch. However, in cases like this, the balloon may not cross to the side branch because it gets obstructed here. So what you can do to make that unlikely to happen is to proximal optimization technique. And you pass a balloon, here's a balloon, up to the corona, which is this point here. You inflate the balloon, and that expands the stent proximally, making it unlikely that your wire will go outside the stent, and more likely to go inside the stent and then enter the side branch. A balloon may catch on a complex part of a cell. For instance, here, this is a more complex part of a cell, whereas here is not. So the balloon may catch here, and the solution may be to rewire the side branch. Also, the angle of approach. If you are approaching on an angle like this, the balloon is less likely to cross. But if you're more perpendicular to the stent, it is more likely to cross. So in summary, balloon catheter tip damage is common with attempted side branch access. Tip damage is a major cause of failure to cross the side branch, which is essential in bifurcation stenting. A damaged tip may distort a stent. Tip diameters of all balloon sizes of one size are the same. The width of the zone of balloon attachment increases with nominal balloon size and with non-compliant balloon material. Extraluminal wire passage is prevented by proximal optimization treatment. The complex shape of some cells may prevent balloon passage, and the angle of approach may be important. Thank you very much.
Thank you, Dr. John, for your talk.